everyone, how are you all doing? Welcome to our taboo topic channel where we talk about women or female pelvic floor issues, problems and disorders. So today we're going to talk about stress incontinence. I know I owe you all lots of videos, but you're gonna get that in the next coming weeks with the exercises and then all the information that you need. So today, as I said, our pelvic floor disorder or problem that we're going to be discussing is the stress incontinence. Are you leaking urine when you run, when you sneeze, when you cough? This would be the topic for you. And I always say we try as much as possible on this channel to make things as simple as possible, no technical or medical terms if possible, or we try as much as possible to explain it so that everyone understands it. So here we have our pelvic floor model again. Hello ladies, there it is, that's the back and the front, and then this would be the position when we lie down. So as we mentioned in our previous video looking at the anatomy of the pelvic area, we spoke about the three different organs that we have. That would be the bladder, that's the womb, the fallopian tubes, and that's the rectum behind. So this is how it looks like, and then we have our pelvic floor muscles, the superficials, and then the deep ones when we take out these organs here, and then we have them on the sides as well. So like they are our supporting tool of our pelvic floor organs. Now, urine is actually being produced in our kidneys, and it goes down through a tube to our bladder, and then the bladder stores the urine. And when the bladder is full, what actually happens, I'm going to take out the bladder quickly. When it is full, we have stretch receptors inside it that actually sends information to the spinal cord, then to the brain, that hey, you know, the bladder is really full. So the brain sends back the information to the muscles for them to relax, and then they open up, and then the urine comes out. If we have a good pelvic floor muscle control and we don't have any issues, what happens, we can actually delay going to the toilet to pass urine or to urinate, because the pelvic floor muscle is good enough to contract and say, hey, you know, I'm busy, I want to finish up one or two activities that I'm doing, or I'm walking, I need to finish this task and it's gonna take me like 30 minutes and I would like to hold it for 30 minutes. They contract, and then this information is sent to the brain, and then the muscles are not relaxed and you can hold up the urine. Now, in stress incontinence, it's the other way around. We cannot actually control the urine when the bladder is full. As soon as there's a pressure on our bladder when it is full, or even if it is not full, the muscles relax, and then we either leak urine, or the whole bladder would be actually emptied, or just a bit of drips would come out. It depends on exactly how serious it is. So the stress incontinence basically happens when we lose urine or when we leak urine during our activities. Let's say sneezing. When we sneeze or cough, the abdominal pressure, you can try it now, you can cough and you would realize that your abdominal pressure increases, and this presses on the bladder, and then the pelvic muscles when they are weak, they cannot hold back, and then they just relax, and then the urine comes out in a simple way. Now that we know actually what stress incontinence is, we're going to talk about the symptoms. The symptoms would be when you cough, urine comes out. When you sneeze, urine comes out. When you jog, urine comes out. When you run after your kids. I mean, as women, we all know all the things that we have to go through during the day. And then thinking about all these activities that you do, and any of them that you do, you leak. And I think it can be very difficult, or it can be challenging going through this situation for like months and years and not having it looked at or treated. Like I always say, these videos are to give you awareness, to give you the information. But as soon as you have these signs, please contact your doctor, see your doctor, and see exactly what is causing your incontinence or the leak of urine, and then get a proper treatment for it. Lifting would be another symptom, jumping would be another symptom, and then pregnancy can be another symptom. I have 2 kids, and I know especially the later stages of pregnancy, I couldn't hold my urine for like 15 minutes. As soon as I realized that the bladder is full, I was running to get to urinate. And then you could imagine when your pelvic floor muscle is already weak. By the time you even realize that your bladder is full, you're already running and the urine is leaking behind you. So we can actually train these muscles. Sometimes also when we are having sex or making love and you have this pressure actually hitting on the bladder, when urine comes out, it could be a sign that the pelvic floor muscle is actually weak. And so many other physical activities, sports. The women that are very sporty, that love to do different activities, they are running, they are lifting weights and all that. When the pelvic floor muscle is weak, the moment you actually start doing your weightlifting activities and all that, or running or jumping on the trampoline, the urine starts leaking. And then I find, like, when I work with women, especially mothers of 2 or 3, that come to the hospital for the treatment, and then they are just so challenged with these situations. Like, they cannot do so many things with their children anymore. They cannot play with them, because the moment they start running around or behind them in a park, they realize, oops, a drop is coming out and things like that, and they would have to stop. And kids are constantly running and constantly playing, or some kids love to go to the trampoline parks, or even at home when they have their trampolines, they want to jump on the trampolines and enjoy it and all that. And then trampoline sport, it's a very high impact sport on our pelvic floor muscles. So you can imagine every jump that you do, something urine comes out. It can be very stressful. So these are some of the signs that when you have them, please try to get that checked out with your doctor. But then let's say pregnancy and childbirth. You can imagine being 9 months pregnant, and then every month your child is growing, getting heavier, and then these muscles are supporting this weight all these months. And then at childbirth, we have the muscles here actually stretching, actually overstretching for the baby to come out. It has a very big impact on our pelvic floor muscles. Right after birth, weeks later, actually we at our hospital, we start hours after women deliver to tell them what they can do, what they cannot do, what they should do, what they should not do, and how they can activate their pelvic floor muscles. It's not about training the pelvic floor muscle power-wise, but just the activation of it during the next few weeks. It depends if they have vaginal tear and all that. These I would do on a separate video, but on this video we're just going to concentrate on our stress incontinence. So it is important for women to actually train this muscle, whether you are pregnant, whether you already have kids, if you're not pregnant yet, or if you're still young. We can always train the muscle at any time. So it's never too late to actually train our muscles. After having looked at the stress incontinences, the symptoms, and these 2 important factors that I just mentioned, that is pregnancy and childbirth, we're going to look at the treatment possibilities. You have different possibilities. Your doctors would evaluate you and then tell you exactly what you need. On this channel, we're basically going to look at our physical therapy exercises that we can do to help activate first and foremost our pelvic floor muscles, and then improve the muscle power, the coordination of our pelvic floor muscles. So I'm going to show you all 4 exercises that are very practical and easy that you can do at home, in the office, or when you're in a bus or a train, or wherever you are. So if you have questions, please ask your questions. If you want to share experiences, I would love to hear your experiences. And then let's dive into the 4 exercises. Before we get into the exercises, I have 3 fundamental important things that I want to share with you all, because when you do these things wrongly, it doesn't matter how much exercises you do or what for exercises you do for your pelvic floor, they are all totally wrong. So here they are. The breathing, that is the very first thing. When we breathe, we need to breathe correctly. That is, what is correctly? We inhale through the nose, and when we inhale, our tummy comes up, and then when we exhale, it goes right back in. So the belly button actually moves towards our spine. That is how we correctly breathe. And then, so when we do the exercises, we are not allowed to hold our breath to get our contraction. If not, you can breathe superficially and then have your squeeze and nice and gentle done. The other thing is the core contraction. The core contraction is actually using the right muscles that would help you support, contract your pelvic floor muscles. How do we do that, and how do you identify to know that you're doing the right thing? It's basically locating your pelvic bone right here, or hip bone, people call it differently. And then it's better when you lie down on your back. We'll do that when I lie down on my back, but just basically showing you all is using your fingers and supporting it. When you find this bone here, just gently press on it and don't press hard, and then inhale through the nose. As we said, our tummy comes up, and then exhale through the mouth, and tummy goes back right in. Then you feel a slight contraction of your transversus muscle. Third thing is the pelvic floor muscle contraction itself, the squeezing that muscle. It is very difficult because most people do not have the awareness of the muscle, so they tend to squeeze the buttocks or the tummy in or the thighs. They are all wrong. So it's basically very gentle, and you don't have to squeeze and so tight. What we're gonna do, like I showed you all, I think in the first video, how to locate our pelvic floor muscles. Use your palm or hands and sit right on them. I'm sitting on both hands now, and I'm going to slightly lean on the sides, and then you would feel your sit bone, well, both of them. And then when you spot it, right in between these 2 bones is where our pelvic floor is. That's where we find the vagina, that's where we find the anus and all. So what are we going to do? We're going to gently squeeze our vagina muscles and pull it up and release. If you cannot find it, what I usually tell my patients is, imagine that you are urinating and you're trying to stop your urine from coming. That is the pelvic floor muscle doing that. Or you feel like you want to pass gas and you're trying to stop your gas from passing through from the anus. These are the pelvic floor muscles that you need to contract. So when you could imagine stopping the urine from coming or the gas from passing through, then you are squeezing your right muscles. Great. Now that you have the basics, I'm going to combine all these 3 in one, and then we're going to do the rest of the exercises in different positions and practical ones that you can actually do at home. You don't need like equipment or devices to do this exercise. Okay ladies, so here we are on the mat as I promised, and now we're going to combine all the 3. We're going to combine the breathing and then feeling those core contractions and then squeezing our pelvic floor muscle. These are the exercises, and then you can combine it with every other movement. So now our first exercise would be inhaling through the nose, hands on the tummy for us to feel how our tummy is going. It's just going to support us or guide us that we're doing the right breathing. So we inhale through the nose, tummy comes up, and exhale through the mouth. it goes back in, and then squeeze the pelvic floor muscles. I'm imagining stopping my urine from coming, and then holding it for 10 seconds and letting go. And then we said, when we want to feel that we are contracting the right muscles, we just find this bone here, put our hands in it, and then inhale through the nose again. And let go. So, like I said before, we're not allowed to actually hold our breath, so you can breathe superficially while you're holding your pelvic floor muscle. It might be difficult in the beginning, but eventually you'll get there. So now we're gonna go do a second exercise that would be inhale through the nose again, exhale. Squeeze the pelvic floor muscle and lift it, and then the bridge. Hold it right there. Don't contract your butt or your thighs on your tummy. So see, my tummy is very relaxed. Hold it for 10 seconds and then go back down again. Again. And down. Very well. And then the next exercise that we're going to do, we're gonna go on the 4 points, and the back, this position is quite important. The back is not supposed to be like this or like that. So we have to find a neutral position for our back and then find a very comfortable position there. Our legs are not closed, it's just slightly open. Don't forget that we're going to combine every movement with breathing, and we're going to breathe in our tummy out and out, and then we are in this position with the squeeze pelvic floor muscles, 10 seconds, and then back again. Again, find your neutral position of the back. Inhale, breathe in, out, squeeze the pelvic floor muscles and then lift them, and then do the next movement. 10 seconds and then back again. So our next exercise is going to be in a sitting position. This you can do at home, you can do in your office and wherever you are seated. Make sure that our back is straight. Again, this would be the exercise. So I'm going to show you all back straight, feet on the floor, not like this. The hands in between our legs or thighs or knees. And then we're going to inhale through the nose again. Exhale, squeeze our pelvic floor muscle and lift it up, and then try to open our legs while we are giving a bit of resistance with our hands. Stay for 10 seconds and then let go. And this is something you can also do from sideways, trying to open. But we're going to prevent this movement from happening, opening the legs, and we're going to add the resistance with our hand. Again, inhale, exhale, squeeze the pelvic floor muscles and lift them up, and then try to open your legs. And I'm trying to hold the contractions. Very well. 10 seconds and let go. These are 2 exercises you can actually do as well. 10 repetitions of each. Stay 10 seconds if you can. If you can only stay for 2-3 seconds, stay for 2-3 seconds. When you lose the contraction or the squeeze in your pelvic floor muscle, just relax and repeat it again. And eventually you'll be able to do more repetitions. our very last exercise for the stress incontinence would be a bit dynamic. We're going to stand up and then we're going to do the treatment. Important is that every exercise eventually gets to a dynamic position with jumping, running, hopping and all that. But we're not going to show all those exercises. If you're interested in these exercises, or contact me to get more of these exercises or coaching. So this is going to be the last exercise for you all for the stress incontinence therapy, and then I'm going to show you all, because like we did it in sitting, lying down, and this is going to be the dynamic one that I'm going to show you all, because when we have these problems, it's not only when we are at home, but it could be when we're on the road or at work and all that. So the last exercise for you all today is everything again. Breathing in through the nose, tummy out, breathing out through the mouth. Tummy goes right back in. We squeeze those pelvic floor muscles, imagining that we're stopping the urine from coming or the gas from passing through, lifting it up, and then doing the exercise. So we're just gonna go a bit in this position, like my back is straight. It's not like this, but straight, a bit of a bend, slight bend on the knees, and then with the pelvic floor contraction or the squeeze and lifting that we have, we would be jumping and letting go. Again, inhale, exhale, squeeze and lift, bend, maintain the squeeze, the contraction that you have, and then jump again. So we can do these jumps forward, backward, sideways, again. So until next week, I hope these exercises would help you start with your pelvic floor training. If you have questions, if you want personal coaching, just contact me and I'll see you next week. Bye bye.